Hi, I'm Colleen Hutchinson. I'm here at the 18th Annual Minimally Invasive Surgery Symposium at the Wynn Encore Las Vegas. I have here with me today Stacy Brethauer. Stacy, thank you for being with us.
No, my pleasure.
Can you just tell us a little bit about yourself first?
Sure. So I'm a bariatric surgeon, foregut surgeon at the Cleveland Clinic in Cleveland. I'm the immediate past president of the ASMBS and one of the co-directors for one of the sessions here at MISS.
Can you give us an update on the National Enhanced Recovery Project?
Sure. So this is a project that we started about a year and a half ago. The name of it is ENERGY. It stands for, employing new enhanced recovery goals in bariatric surgery. There's 35 centers participating across the country. We have gotten through our first quarter of data collection. We had a 6-month run-up period where people were implementing the protocol and sort of getting that culture change within their programs. And now we've got a first quarter of data coming together, and we're going to run the project all the way through the end of June. And so hopefully certainly by next year at MISS, but even next fall at Obesity Week, we hope to have some data really supporting the safety and the value of adding enhanced recovery to your bariatric surgery program.
So this is the first year that MISS added another vertical of enhanced recovery. What compelled you to add that, and then what value does that add for the attendees?
Yeah, I think enhanced recovery is a concept that a lot of surgeons still aren't that familiar with. They kind of may be even employing parts of those pathways in their practice, but the comprehensive protocol or pathway of enhanced recovery really is something that a lot of folks just aren't really fully aware of. And so by adding it to the program, and we've intermixed it in with several different tracks so that people get exposed to it and really can understand that there's a lot of data around how to employ enhanced recovery pathways and what the real value is in terms of patient outcomes and cost.
Yeah, so in terms of people knowing about it, that SAGES poll that showed 30% of people did not know what enhanced recovery was.
Right.
What's being done to remedy that?
That's shocking because SAGES is a very progressive, forward-thinking, surgical society, and these are a lot of folks that are doing, setting the stage sort of nationally. But it just speaks to the fact that employing these things really requires a culture change in your program, and it does challenge a lot of the dogma that we have been doing things because we've always done them that way. And so I think by sort of putting this out there on a national stage through the ENERGY project and putting it into meetings like this, and the ASMBS, we're implementing enhanced recovery tracks within our program as well. Hopefully we can, permeate out into the practicing surgeons a little bit more and make sure that they're doing these things that really help patient care.
Would you say that logistically it's going to be as easy for a community practice to implement a program as it is maybe in an academic practice?
Yeah, in some ways it might be easier because it's maybe not quite as many moving parts as an academic center, and the stakeholders probably can get together a little bit easier sometimes in that smaller setting. So a lot of the enhanced recovery has come from smaller group settings, private settings, and in our ENERGY project, those seem to be the programs that were most easily able to adapt to this new protocol because they could get all the stakeholders together, everyone agreed it was a great idea, and they made it happen. Whereas sometimes the academic centers have a lot of different stakeholders coming from different perspectives, and it can be a little more challenging sometimes. Yeah.
Well, thank you for being with us here
my
today
pleasure.
and for sharing
My pleasure.
your insights.
Thanks, Colleen.